Namaskar. I am Dr. Aditya Kumar Sharma, urologist at Max Super Specialty Hospital, Lucknow. Today, I will be demonstrating what is a urodynamic study and what are the equipment involved in a urodynamic study. Urodynamic study is a specialized test where we try to understand the mechanism or functioning of the urinary bladder. What kind of pressures it is generating. Is the bladder pressures which is contributing to the urine flow, or is it the abdominal pressure? So this is a very specialized machine. So this is a totally wireless urodynamic system which we have available with us. In this system, this is the transducer which transmits the signal. You can see this all the urodynamic readings which come here. Okay, and in this transducer, these are different type of connections which are available. So this one is a bladder filling catheter. With this, the saline is filled into the urinary bladder. There is another catheter which is used to measure rectal pressures. So there is a transducer which is connected through the balloon which goes into the rectal cavity, which measures the abdominal pressure. There is another transducer which measures the vesical pressure or the bladder pressures. So how do we measure what is the true bladder pressure? By deducting total vesical pressure minus the abdominal pressure. By this method, we understand what kind of pressures patient is generating. So there are specialized catheters which are used to measure the bladder pressures. So this is a double lumen catheter which is inserted, very thin 7 French catheter which is inserted. These are sterilized packed. These are inserted into the urethral lumen, and one is lumen is used to fill the bladder and another lumen is used to measure the bladder pressures. There is another catheter which is the rectal balloon catheter. So there is a balloon at the end. This goes into the rectal cavity and this again measures the abdominal pressures. So all these things constitute the part of the urodynamic equipment which is on the patient side. And nonetheless, this is a very specialized high-end urodynamics chair, because some patients are comfortable passing urine in sitting position. While filling, we have to make the chair straight. So this is a automatic electronically operated chair where we can adjust height and bend of the back, and we can make patient sit comfortably while doing the procedure. So these all equipment are needed for urodynamic study. So this is the patient side equipment. Now I will demonstrate how the readings are read on the computer. So all the readings are transferred wirelessly to this urodynamic system. This is totally computerized measurement of the bladder pressure readings. As you can see there we can see different graphs which are recorded during the study of the patient. The first one is the vesical pressure. These are the pressures of the urinary bladder. How the bladder pressures are being recorded through the vesical catheter which I told you. Second one, this red one, is the abdominal pressure or the rectal pressure. Third one, the green one, is the when we subtract abdominal pressure from the vesical pressure, what we get is the vesical pressure. So it is a true detrusor pressure. It is the pressure which is generated by the muscles of the urinary bladder. This is the volume which we are filling, and when the patient has urge to void, this is the urinary flow which is being recorded. So after completing the study, we again empty the bladder with the help of the syringe and measure the post-void residual urine. So like for a sample case, we can see here the vesical pressures are quite high. There is not much abdominal pressure is being generated for voiding, and the true detrusor pressures are going up to 165. These are very high pressure. So in a way, and patient has poor flow. So in a way, we can see the bladder capacity is slightly reduced, and due to very high bladder pressures, we can conclude that patient is having bladder outlet obstruction. So such patient has very good bladder pressures, but he is not able to pass urine well. This patient, due to high pressures, there is risk of damage to the upper urinary tract. So in such a case, with bladder outlet obstruction, if the prostate surgery is done, there is very good chance of recovery. There can be another case where bladder pressures are not very good. In those cases, we may not see very good recovery. We will discuss those cases in future videos. So this is the entire urodynamic setup, and this is totally wireless and state-of-the-art and very high-end equipment. So with this computerized software and this entire equipment, we are able to do urodynamic study with utmost hygiene and without any risk of any infection. With this equipment, we are able to make decisions which are very tricky. Otherwise, many times the prostate size is not very big, and we have to decide whether it is truly something obstructing or patient has lost his bladder pressures. Because in such a case, the patient will not have a very good outcome if we directly go ahead and do the surgery. So this is very much required in cases where we are planning to do a prostate surgery, and with this we can conclude what kind of outcome patient will have. For more such video and information, please subscribe to our channel and stay healthy, stay blessed, take care.